I think this might be the most prompt group around. Welcome, everybody. My name is Tulsi Modi. I am an intern at Planetary Health. Thank you so much for taking time during this conference to join us here today. Today's workshop, Clinicians for Planetary Health, Developing Trusted Voices for Planetary Health. It will be led by the one and only Teddie Potter. I don't know much about her, but I've heard she's a complete rock star, so I will leave it up to her to begin.
Thank you. I appreciate that introduction. We have designed today to be really a gathering place, a meeting place. And as you might have heard me say yesterday, all people are welcome. Whether you're a clinician, you're studying to be a clinician, you've ever been cared for by a clinician, or you're just curious what's happening at 4 in the afternoon on this day. We welcome all of you. We do have an audience attending virtually via Zoom. So if we come to our time when we ask questions or ask for feedback, either go to the mic, and apparently you do need to get like right there. So go to the mic, or we can run the mic to you, but we need to make sure that we are inclusive of our virtual audience. So we plan today to give you a sense of messages from nursing, messages from physicians, from public health, from dietitians, from the broader clinician experience. Clinicians for Planetary Health is a standing committee of the Planetary Health Alliance. So at the end, we're going to tell you how you can join us and be part of the movement. And speaking of movement, let's see if the slides will move. Otherwise, I might need to, yeah? Maybe they're out of batteries. Can you run it back there? You can't. Oh, there we go. Okay. So I'm Teddie Potter. Besides that nice claim of being a rock star, I am also Director of Planetary Health at the School of Nursing at the University of Minnesota. And I also coordinate the Doctor of Nursing Practice and Health Innovation and Leadership. Today we have Dr. Kristen Robb, who is the Director of Minnesota, the Department of Health, Climate and Health Program. We have Enrique Barros, who is a family doctor in Brazil, and former, really tiny, okay. A former member or chair of the Working Party on the Environment of the World Organization of Family Doctors. We have Dr. Roberto Almeida, who is professor, also works with the ICU, emergency medicine, and is the coordinator of, founder of the Brazilian College of Lifestyle Medicine. We have Vanessa Goes, who is an integrative health professional, a registered dietitian, and about as full of life as anybody can be. And we have Melissa Lim, who will be joining us virtually from Canada. She is a physician, and she's director of Park Prescriptions. So we do plan on doing fairly quick 10-minute talks, each of us, and then there's going to be plenty of time for you folks to engage in some questions that we have. And that's a very vital part of this discussion. So without further delay, I'm going to introduce you to Kristen Robb.
Thank you, everyone. I'm so excited to be here and talking with you today. It's been just a fabulous conference, and this is my first Planetary Health conference, so nice to be able to network with so many fabulous people. Again, I'm Kristen Robb, and I'm going to kick off our panelist presentation today to talk about some research that we recently completed surveying health professionals about the health impacts of climate change, whether or not they're discussing those impacts with their patients, what the barriers are to those discussions, and then what are some of the opportunities we can seize upon to eliminate those barriers. So before I begin, I do want to acknowledge the fantastic collaborative team that came together to do this research, especially highlighting the main author, who's Madison Kirschner, who was a fellow from the Council of State and Territorial Epidemiologists at the time. And you can also see that Teddie was also part of this research team. And the research I'm presenting today has just been published today in Challenges. So you can see it there. Thank you very much. So as you know, human health is intrinsically linked to the health of the biosphere. And humans continue to disrupt our Earth natural systems via emitting greenhouse gases, causing drastic and catastrophic changes to our air, water, weather, and ecosystems that are affecting all life on Earth. And climate change is a very visible planetary health crisis and has been called by the World Health Organization the single biggest health threat facing humanity. So as you know, there are many, many health impacts of climate change. I'm just going to run through a few of them. There's heat-related illnesses from extreme heat events, respiratory illnesses from more air pollution and wildfire smoke, zoonotic and vector-borne diseases from changing climatic conditions, water and food-borne illnesses from extreme precipitation and drought, impaired mental health, which we've been talking about, from experiencing a disaster or from feeling hopeless in the face of what seems like a very insurmountable problem. And then there are injuries and deaths related to those severe events. And this is just the tip of the iceberg of those health impacts. Climate change also exacerbates existing conditions and further contributes to the health and socioeconomic disparities, so that those that contribute the least to climate change are the most impacted. Well, this is a very gloomy scenario. There is hope, and mitigating climate change can have the co-benefits of improving health and improving the systems, the air, water, food, ecosystems that all life on this planet depends. And health professionals can be part of the solution. Health professionals see the health impacts of climate change firsthand and can talk about the health impacts that are happening locally. So that is, they can directly connect that planetary health issue to a local personal health issue. We all care about our health, we all care about our family's health, so making something that vast, comprehensible is super important. And healthcare professionals are also trusted voices. They have qualities that make them trustworthy. They're technically competent, they are experts in healthcare, they just demonstrate moral character, they are in the medical professional to help other people, and they demonstrate caring towards the patient. This gives healthcare providers a lot of power to plant seeds that the health impacts of climate change are real, they're happening locally, they're things that you can do to stay safe, and there are ways you can be part of the solution to saving our planet. So why did we do this study in Minnesota? And if you don't know where Minnesota is, it's that pink blob on the map. We did the study to better understand what healthcare providers are seeing in their practice. So what kinds of health impacts are they actually seeing? What are the attitudes that they have towards climate change? Are they talking about climate change with their patients? And what kinds of barriers do they have to engage with these conversations? So this survey that we did was sent out electronically to members of the Minnesota Board of Nursing and to several professional healthcare nursing and physician organizations. This was done in April 2021. So we received a pretty good response for a survey. We received almost 4,500 responses. The vast majority, as you can see here, were nurses, so that's 97%. Most of them were female, 87%. The average age was 50 years, and the average practicing was 22 years. So this was a group that had a lot of experience. We did do a chi-square on age and belief in climate change, and we did find statistically significant that those that are younger are more likely to believe in climate change. So we asked them some statements, whether they agreed or disagreed, and one of the first questions we asked was, climate change is happening, and 95% strongly agreed that climate change is happening, which was slightly higher than Minnesota and the national average at the time, which was 72%. And 60% strongly agreed that climate change directly or indirectly impacts the health of my patients, clients, or community members. So among those who strongly agreed, neither agreed or disagreed that climate change impacts health, so 78% of those 78%, 74% considered climate change to always, often, or sometimes play a role in exacerbating or causing respiratory problems. The second condition that they linked to climate change was mental health issues at 66%. The third was heat-related illness, and you can see the others listed on this slide. Out of those, that sample, 76% expressed concern about the health impacts of climate change on their patients, and almost 60% said that healthcare professionals are positioned to help patients understand those health impacts and that they should have an active role in discussing it with their patients. So the vast majority did think that they should have a role in doing that. But only 1 in 5 felt comfortable or prepared to discuss the health impacts of climate change. So this tells us that healthcare providers are seeing health impacts of climate change in their patients. They are concerned and they think they should be helping their patients, but they don't feel comfortable or prepared to do so. So this might explain why only 4% of those respondents reported that they discuss the health impacts of climate change with all or most of their patients. The vast majority, or 83%, stated that they never talk about the health impacts of climate change, or only with very few. All right. So this was further confirmed when we asked the question about barriers to discussing climate change. And the number one barrier was lack of knowledge. So we thought time might be the number one barrier, but in fact, it was lack of knowledge. So we also asked about resources that would be useful. The top was continuing education courses, then research articles, and then third, patient or client educational materials. So while our survey focused on climate change, we believe that the strategies to overcome some of these barriers, such as those listed on this slide, are useful for promoting planetary health as well. So the Minnesota Department of Health, with colleagues, including Teddie, are developing resources to fill those knowledge gaps, including a video demonstrating how to have those difficult conversations, and a brochure that provides step-by-step instructions on how to engage with patients through an on-ramp discussion, either a current event or perhaps a climate-related illness like heat, having that dialogue, and then transitioning to another health issue that's important to the patient. And we'll be happy to share these resources with you when we're complete. So in summary, healthcare providers can be a trusted voice in climate and planetary health conversations. The majority of the respondents to the survey thought that climate change is happening and it's currently impacting patients. They're concerned, they believe they have a role in addressing climate change, that they don't feel prepared or comfortable, and it's things we can do, training and building resources to address those barriers. So with that, I want to say thank you.
Hello, can you hear me? Let's see. Okay, so I'm Enrique, and I'm going to talk a little bit about what I do in my office, or try to do. Talk about 1 minute about the planet, and just to remind us that this year the Day of Health by the World Health Organization was our planet and our health, and this was a beautiful picture that they used. So we have to contextualize how you teach your patient about planetary health or climate change. So this is where I come from. I work in this little town, 6,000 people, in the middle of the mountains in southern Brazil. And this is very important to the clinical case that I'm going to show. So this is Brazil. I'm sorry I put it upside down. But no, not really, just to show that perspectives are important. So the yellow arrow is where I live, okay, just very close to Argentina and Uruguay. And my team to the right. And this is a mother and child that came to my office in February, which is our summer, in the northern hemisphere, as you saw there. And the baby came with a fever and a rash, and the mother came with dyspnea and wheezing. Does anyone want to guess the diagnosis? Maybe I misdiagnosed, but I think I was right. Yeah. So the baby girl had dengue, and it was the first diagnosis of dengue in my community. Since it's in the mountains of Brazil, we never had either the mosquito. I'm there for the past 12 years. We never had the mosquito. We have it for like 2 years. And this is the first documented case of dengue in my community. So it's pretty symbolic. And the woman had dyspnea and wheezing. She had long COVID and exacerbated asthma because of that. So I gave them the evidence-based medicine. I tried to do my best, of course, and avoid the complications from dengue by avoiding non-steroidal drugs, anti-inflammatory non-steroidal drugs. It's not good for dengue, then you can look it up later. And then try to give the mom good medication for asthma, including the up-to-date medication, I'll talk about it later, which is less polluting. This is just to show quickly that the carrying capacity, the vectorial capacity of the Aedes is increasing due to heat and rain and plastic stuff that mosquitoes can grow on. So this is very important for the way I look talking to patients, which is evidence-based medicine. So you need the best external evidence, you need clinical judgment, and the most important, you need to respect the values of the patients. So there are many things you can do if you use that. So this is the medication. Most, for instance, in the UK, most doctors still prescribe the left one, which is a lot more polluting than the one on the right that mixes corticosteroid plus formoterol. It's much better for your health, okay? So evidence-based medicine teaches you how to improve the health and pollute less. And again, so evidence-based medicine has shown that you need first contact, continuity of care, comprehensiveness, and coordination to have higher performing systems of health. So that's the function of primary care. Okay, so primary care providers are in a very good position to offer evidence-based health interventions, and when they get very acquainted with the patient, with family orientation, cultural competency, and getting acquainted, community orientation, they can see the planetary health connections easier to the patient, as it happened on that case. So another way to look at this, so you have the patient-centered approach, mom and child. You have the attributes of primary care, strong attributes, access, continuity of care, comprehensiveness, and coordination, right? So we know the family. Actually, sometimes I have to speak in some Deutsch dialect, German dialect, because a lot of them are German descendants. And then you have community orientation, and then on top of that, you can try to connect with planetary health. Actually, I feel it's quite normal if you just pay attention to it. So our patient walks into the office, right? My leg is burning, and the doctor tries to examine, and the whole planet is interconnected and it's breaking, right? This is just a paper that I collaborated with, showing the health system for developing countries with low carbon. So basically reducing the hospital on the top left and improving primary care, which is the little house. It's much more effective and cheaper, and improving telehealth on the left down corner. And I'm not going to talk about the other things, but clean energy and stuff like that, and active transportation. So I wanted to get to this. We were talking about how some colleagues can lose track of the meaning of their healthcare profession, and I see that happening to my students. So many times my students come with a very compassionate heart. So you see the axis of heart and the axis of mind. And they go to the university with a very compassionate heart, but they don't get the best technical and scientific and humanistic perspective to understand patients and the planet and nature, and feel, understand and be prepared to tend to these patients. So many times they move to the lower left, which is you don't have the technology, then your heart has to sort of build a nut or like a case so that it doesn't get even more frustrated. And the challenge for us is to go to the right upper corner, which is to give the best technology and the best science. And by technology, I mean soft technology, which depends on a lot of research, a lot of knowledge, but not necessarily having a super peeing machine. If you know what the pee machine is, go look for the Monty Python. They have the pee machine there. You'll love it. And so I think I want to be on the right upper corner. And to those that don't know, the pledge for Planetary Health to unite health professionals in the Anthropocene, I solemnly pledge to dedicate my life to the service of humanity and to the protection of natural systems on which human health depends. And then it goes a little bit further. And that's it.
Hello. I'd like to say thank you for the opportunity to share with you my experience as a clinician to transform my practice, including lifestyle medicine and planetary health. And whatever is the concept that you use to apply to these transformations that the humanity is treating the planet. I put two images here to say that we have to move from one way to deal or to be in this planet to another more careful way. What is important here is that our position as a clinicians is very important to cooperate with educators. I have been working with educators 7 years, and I see a lot of potential in these connections and work with educators to create a better present future for all living beings in this planet. First, I would like to say about my personal and professional transformation, because I have been working with medicine since I graduated in 1994. After 20 years of working with emergency care and intensive care, I'm always concerned about the internal systems of people that are in danger or in sickness. And when I was invited to take part of the UNILA, that is a federal university of Latin America integration, they decided to create a medical school over there, and I was involved in some way with the program of residence. And then that was a kind of a crisis to me, because I was at this point of my career in some way frustrated, and I realized that the way we practice medicine is unsustainable. I think that the way we treat patients and the solutions that we present are not sustainable. And then I was concerned about what I will teach to the new generation of doctors and students. And I tried to look for what kind of new approaches to health. And I came to United States to see what is lifestyle medicine. In 2014, I came to San Diego, and was my first conference in lifestyle medicine, and the topic was treat the cause. I liked this idea because the cause, that means the lifestyle, the social determinants, and environmental determinants of the health. And then, for my surprise, or for my expansion of vision, in 2016, the conference has the title of Health People on Health Planet, or Health People, Health Planet. And the conference, Samuel Myers presented the lifestyle medicine through the lens of planetary health. Wow, was fantastic. I heard about this, and everything makes sense for me since then. And I start this movement to create something, a way to not just like the conferences and talk with some friends here, but how can I go to my daily life and work with this? And then I start design a work, I can say this, that is to work with a concept that is integrative approach to planetary and health education. I will show you some elements of this. First of all, I have opportunity to write a little bit about this. In the middle of this designing this program, I have opportunity to write about this in a chapter of a book. And I have some, over there, this QR code you can access to read a little bit more. But the main message I realized in that moment that this use of integrative health concept was very important. Not in the common sense of integrative medicine or integrative health that promote integration of Western and East approach to health, but in this sense that our behavior and our consciousness is a key element to health of human beings and health of planet. And that is the key point that we need to address in our work, in this work that I'm trying to do, to promote the changes that we need. So I will show you some theories that I found important to design this integrative health program at school. First of all, I found a book, High Level of Wellness, 1961. A Dr. Albert Doom said about the body as the center for our individual well-being. And he said about the mind, in terms of our social roles, where we express our family and community wellness, and he used spiritual to say about our environmental wellness. I like that, these ideas. These three ideas are important from now on. Another reference to this work, I found, I don't know, I'm not sure, this man, John Houghton, medical doctor, 1971, said about, he used the man's problems. At that time, they used men's, not women and humanity, but men's problems are reducible basically to three. His problem of understanding and living with himself, his problems of understanding and living with his fellow man or society, and his problem of understanding and living with the environment or ecosystem. So that is another important reference in the Challenges journal, very important reference to a group of activists in 1980. Friends of Earth mentioned that it is necessary to change the concept of health, of the World Health Organization, and they said that health is a state of complete physical, mental, social, and ecological well-being, and not merely the absence of disease. Personal health involves planetary health. That I think is important to mention. And in terms of doing something, this three I think is very important because Otto Scharmer is a very important researcher in terms of action research, and he presents that we have these three kind of divides. Ecological divide that separate us from nature, social divide that separate us from each other, and spiritual divide that separate us from ourselves. I usually have a presentation to show to the teachers, to the audience, what means these spiritual disconnections. Is the disconnection inside of our intrapersonal environment. We have an environment inside of us. And this is what creates a disconnection between us and our better version of ourselves. And social disconnections is in the social cultural environment. We have a lot of problems with communications, technology, indifference and social distance, a lot of racial and other economic problems. And our disconnections in the environment, natural environment. This is three kinds. That means that integrative planetary health means reconnections. We need to promote with our actions as clinicians in all kind of environments, corporations, all kind of situations. We can promote this new way to see health. Connection with ourselves, connect with each other, and connect with the nature environment. Another reference important to educators is this book of Daniel Goleman and Peter Senge, that they try to teach a new approach to education in this century. They call the triple focus. The inner focus on our attention ourselves, other focus, attention to the other, and outer focus attention to the whole and the planet. And this is very important because here attention means mindfulness. We need to be more mindful, more aware, more present to take care of ourselves, other, and the planet. And of course, we have the reference here to the paper that started this movement, the Safeguarding Human Health in the Anthropocene Age. And of course, here we can find these three elements that our well-being, human well-being, is related to our human systems and the natural systems. Will be very important because I realize that the human civilization are related with anthropogenic and anthropocentric systems. We can list a lot of systems, I think all systems. And these create our civilization, these systems that we live inside. And these systems are designed to protect us and to promote our well-being. But what we are saying now with planetary health, that human health planetary health is the health of our civilizations. That means that we need to take care of these systems and change them because our health and the planet health depends on this. And then this movement of that we are trying to do here is related with this planetary health means consciousness-based system change. And then we need to change our ecosystem consciousness to a more ecosystem consciousness. Yes, I have some other reference here, but my time is finishing. And of course, the design of program is related with the core of the values and consciousness, and all these choices that we do in terms of our personal health or human health or health connections are always based on our values and the level of consciousness that we have around this. Then, with this, I would have to be very quickly here now to show the importance of integration. This concept of integration is very important because life is starting this planet in this green arrow, and the differentiation, the process of biodiversity create harmony. And now we have to be very compassionate minds to see ourselves that we are disrupting the harmony in this planet. We need to be very compassionate, and without using us again, then find solution. Well, to finish, I put this together and need another kind of intelligence we call planetary intelligence. And I have to say this final phrase here: planetary health is all about seeing, creating, promoting, healing, connections with everything. And I just put this in practice. I show you some images where I put this in practice in this part of Brazil, where they have the Paraná watershed. And over there we have 55 municipalities. I work with these 55 municipalities with a program. And I have been working since 2015. And teachers are my people that I work, and I deliver these in activities like this. Presence, and during the pandemic with this, we use Zoom and other activities, but these activities is very important to connect with people, with community, and try to, with a program workshop with 32 hours, 4 meetings, talking about these 3 levels of health. And because of this, I think these images show what I have been done. And that's it. That's an indigenous phrase to show the resilience and hope of an indigenous school, where I have opportunity to try to understand is in Guarani over there. The phrase says, they cut our branches, burn our trunks, but they did not take our roots. Our father tears will make our leaves grow again. Thank you.
Hello, can you hear me? So, I'm Vanessa Goes, and I will try to in 10 minutes show you how lifestyle medicine is a very powerful approach and framework to integrate planetary health dimension into the clinical practice. So it's pretty clear now the broadness of the determinants of health, and also the interconnectivity and interdependence between them. I should look that. Between people, place, and planet. And it's clear that, I mean, in people, we could read like animals and all living lives, and natural environment are like determinants, very clear. What we need to be more aware of is this bidirectional relationship between lifestyle, the way we live, and the environmental conditions. Actually, it's have these arrows there, but it's the same thing. We should reframe that. It's one. This outer side of environmental conditions and the center, which is like life, people, animals, and bacteria, and everything is the same thing. So it's a huge interconnection between these two points. And we know that also, this connection with planetary and human health. So we know that consumption is one of the underlying drivers of these disruptions, these ecological disruptions that we are facing. And also, culture and behavior are mediating factors of the outcomes of these disruptions in health in general. Lifestyle is really central to both public health and environmental sustainability. Lifestyle and the way you have been living is like what brought us to the Anthropocene. And also, it's the driver, the main driver of this burden of non-communicable diseases that is like with increasing, amazing prevalence. So it's really a time for change, and we should start with us, with what we can do here. So with our values, behaviors, way of living, and there is where lifestyles come in. Lifestyle medicine is not a new concept, planetary health is not a new concept too. These have been there for ages. And it was brought officially by American College of Lifestyle Medicine in 2010. And the definition is lifestyle medicine is an evidence-based approach to prevent, treat, or even reverse diseases by replacing unhealthy behaviors with positive ones. So we have 6 main areas that we focus on. It's eating healthily, being physically active, managing stress, avoiding risky substance abuse, and having adequate sleep, and having a strong support system. And by support system, we are talking about relation with the outside world, so people and environment. So we won't have time to go through this, but I would like to just read that to show you how the lifestyle medicine values are so connected with what we are trying to do here as advocates for planetary health. So it's a comprehensive perspective of health, total health promotion, including social and ecological health. Is a system-based practice. No? So we are engaged in creating policy systems and environmental changes to be able to address these determinants of health. It's a low-cost preventive and multi-sectorial approach, so local, state, national, and international. Is an interdisciplinary collaboration. So we need a multidisciplinary team. No, and we need to build a strategic alliance to be able to reach the mission. It's a value-based care. Within that, with this practice, we are trying to resignify values, cultures, norms, to create new paradigms and structural social change. Clinicians are partners for health, so they are educators, advocates, facilitators of change, and leaders. And also, communication skills are very important in this field to inform and empower the patients. And this is connected to build a community strength. So how do we help people to make the connection? Lifestyle medicine tools, I put tools, but it's this approach. It's 2 sides. The lifestyle intervention prescription. So the prescription is lifestyle interventions. This is very interesting. And also, we have a lot of behavioral change techniques, and we have this health coaching approach, which makes it very different. And it's connected with educative communication practice, too. So really, lifestyle health professionals are very well positioned to coach patients towards climate health behavior changes that heal both people and planet. So it's just to be very brief, just giving examples of 2 of these pillars how they are totally interconnected with planetary health, so just the nutrition and the exercise pillars. So lifestyle medicine, they defend a whole food plant-based diet, which is connected with the Eat Lancet report. And also an active way of life, so active movement, active transportation, and we know that this have a huge impact in the greenhouse productions. So yeah, so we need to understand. So these prescriptions, they help patients to understand the links between health, lifestyle, and health environment. So I just brought like 3 techniques, and I'm going to go very fast through them, but you could, after, look for more references. So one is positive psychology, which was bring for Seligman, and it's about empowering the patient for change. So they work with this model of well-being, they call PERMA. So it talks about positive emotion, engagement, relationships, meaning, achievement. So they work with interventions like to foster gratitude, forgiveness, find purpose, and social connectivity. So really, they are interventions that bring the improvements in emotional well-being and behavior and quality of life. Also, motivational interviewing. It's very powerful tool. It's an approach. It's a collaborative conversation style that enhance motivation and readiness for change. So it's like it comes from the empathy between you and the patient, and it talks about collaboration, compassion, evocation, acceptance, and deals very well with ambivalence, which is very present when people are trying to change their lifestyles and their habits, and it's a very guide directional approach. Yeah, this is Miller and Holnick. Have a lot of work and papers about those techniques. So it's a matter of changing the approach. Now, instead of an expert, you know, you became more an educator and a collaborative person for the change, in listening more instead of informing, motivating more instead of convincing, collaborating more instead of directing. And the last one is the trans-theorical. Oh, okay, it is a trans-theorical model of change. My time is gone. So this is very interesting because it's Prochaska and Di Clemente. They have like 5 stages of change where the patients can transit in the particular behavior, and they can be different of these stages. And you have specific strategies to deal with each one of these stages, so it's very useful. It's finishing. And it's just, this is very important, is an overall approach for behavior change. So you need to have a goal setting, a follow-up, self-monitoring, action planning, problem solving, and social support, very important. And a 5-step process is to be empathetic, align motivation with goals, build confidence, set SMART goals, which you can look for, is very interesting, and measure success and adjust strategies. Yeah, so health professionals must use their trusted voices to advocate for changes, and there is no more time to waste. So, thank you.
I'm up now. I'm assuming people can hear me. I'm Dr. Melissa Lem. I'm calling in to you from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nations, otherwise known as Vancouver, here in Canada. And I'm going to be speaking with you about nature prescribing and why connecting to nature and prescribing it to our patients is one of the best things we can do for our health. And I'm just waiting for my slides to come up. All right, thank you. So these are just a couple of infographics of the many that exist out there that illustrate why connecting to nature is good for us. So from improved bone density to reduced risk of diabetes and heart disease, to improved mental health, reduced symptoms of ADHD in kids, better work satisfaction, actually earlier discharge from hospital. Spending time in nature is one of the best things that we can do for our health. And that's why in our program, we recommend that we view it as the fourth pillar of health, just as important as diet, exercise, and sleep at promoting a healthy lifestyle. Next slide, please. Next slide, please. All right, so you might wonder why nature is so good for our health and what the mechanisms behind it are. And in fact, there are a lot of them. This is just a picture of my son and me in the redwoods in California. So from reducing stress, which reduces cortisol levels, which reduces inflammation, to smelling the smell of nature, so phytoncides, which are volatile organic compounds that research has shown improves our immune system function. Two different psychological theories that I'll explore a bit in the video that I'm going to share. There are lots of different biological, psychological mechanisms that explain why spending time in nature is one of the best things we can do. Next slide, please. So on the topic of this conference, I think it's really important to explore why connecting ourselves and our cities and our patients to nature is good for the planet. So we know that healthcare is a major contributor to global carbon dioxide emissions. Anything that's going to improve patient outcomes and health is going to reduce the burden on the healthcare system and reduce those emissions. Also, in terms of having nature in our cities, not only does it make patients healthier directly by their contact with nature, but it also, green infrastructure makes cities themselves healthier, which I'll explore on the next slide. Research also tells us that children who have more nature experiences are more likely to become adult environmentalists, and adults who are more connected to nature are more likely to protect it. So this applies not only to inspiring conservation, because we protect what we love, but people who are more connected to nature tend to recycle more. They tend to conserve energy more, vote for climate advocates. So I like to think that every time I'm connecting one of my patients to nature, I'm building another advocate for the planet and our health. Also, the executive director of the UN Environment Program has said that nature is one of the most effective ways of combating climate change and should be part of every country's climate strategy. So right now, in terms of global climate investments, it's probably sitting around maybe 5% or less in nature-based solutions for climate change that seek to expand and restore nature while at the same time dealing with human issues and social issues. But in fact, it's been estimated that if we fully embrace these solutions, nature-based solutions for climate change, this will get us over a third of the way towards our Paris target agreements by 2030. So if you look at the gap in potential and investment, I think if we engage our trusted voice as healthcare professionals, advocating for conservation and these nature-based solutions, that'll hopefully inspire decision makers and the public to support more nature in our lives for the planet. Next slide, please. This is a slide, if you look at the graphic, this is a picture, a heat map of the Lower Mainland in Vancouver where I live. And so having nature in our cities from a heat perspective and other perspectives is in fact really good for our urban infrastructure. So urban greening decreases the need for air conditioning through shade. It lowers energy demand, which reduces air pollution and greenhouse gas emissions by reducing burning of fossil fuels. Nature and trees also removes air pollutants from the air, sequesters carbon pollution, reduces flooding. We saw record flooding about a year ago here on the West Coast. That was the most costly extreme weather event in Canada's history. So having more natural infrastructure can also reduce those events. And it's estimated that every $1 invested in a tree returns up to $3 in benefits. So it's a good economic bet as well. And back to this graphic. During the heat dome that happened in June of 2021 that killed over 600 people within the space of 2 weeks, the majority of hospitalizations in my health authority in Vancouver Coastal Health came from the downtown east side, which is that red area in kind of the top center of the map, which not coincidentally also has some of the lowest numbers of tree cover and green space area in the city, which meant that these areas were physically hotter, resulting in worse outcomes for patients. So it's really important to invest in nature in our cities to make sure that we're resilient from a physical and mental health perspective, but also from a heat and environmental resilience perspective. Next slide, please. So just talking a bit about my favorite topic, which is nature prescriptions. We launched nature prescriptions with the BC Parks Foundation in November 2020. And we have a bilingual program with Prescrit Nature in Quebec. We've launched in all 10 provinces. And in fact, I'm really proud of this fact. In less than 2 years, we have managed to register over 5% of all practicing physicians in the country in our program. And when you think about how slow physicians typically are to adopt new practice innovations, I think it speaks to how powerful this message is, that nature is an evidence-based way to improve our health and the health of the planet. And this also includes 10,000 healthcare professionals, regulated health professionals across the country. So if you are a nurse, physiotherapist, psychologist, if you're regulated, you can register to prescribe nature through our program. Next slide, please. So when we prescribe something, obviously we need a dose, right? We don't just kind of prescribe something in general. And in fact, the literature in the last few years has come up with guidelines that we can use around dosing. So this was a study of about 20,000 adults in England, and they asked them to report their health status after controlling for a number of different factors. They found that their likelihood of reporting good health or high well-being was significantly greater when their nature contact hit greater than or equal to 2 hours per week. So that's why we have a standard recommendation. You spend at least 2 hours in nature each week. Next slide, please. And then how much time do you spend in nature each time? And we do recommend at least 20 minutes each time. And this is based on another study that came out in 2019 that looked at 36 urban dwellers over 2 months, had them measure their cortisol levels pre and post nature experiences and non-nature experiences. And then what they found was that their cortisol or stress levels dropped more than 20% after a nature experience compared to a non-nature experience. So a lot of us are busy clinicians, family members, professionals. So if you want the biggest bang for your buck in terms of stress reduction, aim for that 20-minute mark. Next slide, please. All right, and if you register in our program, if you happen to be a clinician from Canada, you'll receive a customized nature prescription file with our standard recommendation. And then we have a whole bunch of evidence-based, nicely designed and attractive resources for physicians or clinicians and patients to emphasize those health benefits of nature and make it easy for people to prescribe nature in busy offices. Next slide, please. All right, we were extremely proud and grateful when the World Health Organization recognized nature prescriptions and our program specifically as a key way to inspire protection and restoration of nature as the foundation of our health in its COP26 special report on climate change and health. Next slide, please. And this was sort of the start of this global amount of awareness, which was when, in fact, we announced our new collaboration with Parks Canada, where prescribers could prescribe one free Parks Canada Discovery Pass per month to their patients to reduce in a tangible way their barriers to nature access. Because it's one thing to prescribe nature, but it's also another thing to make it easier for patients to access it. And so I'm going to play a video soon that's going to show you a story from CNN that they created about our program. Next slide, please. And then finally, next steps for our initiative is launching park prescriptions in the territories and also continuing to collaborate with community partners to reduce those barriers to nature access, whether they be transportation or, again, fees for experiences and access to nature venues. And so if you're in Canada and you know one of these organizations, please don't hesitate to get in touch. And we're also on the verge of launching an app, our PARX app, to track and incentivize nature time. So lots coming down the pipes. And feel free to sign up on our website to receive our newsletter if you want to hear what we're doing. And last but not least, I think one of the biggest joys that I get as a clinician, as a physician, is when I hear from one of my patients how much they've benefited from a nature prescription. And so I just want to share Marjorie's story with you, who's one of the first patients in our program who was prescribed nature. Thanks, everyone.
About a year ago now, I was in talking to my doctor and I just said, I can't shake this depression. He says, I've got just the thing, a prescription for you. I thought, oh goody, one more pill. And he says, no. I want you to spend 2 hours during the week outdoors, minimum 20 minutes each time. And the more I did it, the better I felt. So it all came together way better than any medication I've ever had.
Now, you know she's 75. So I've got to tell you that I'm 91. So that's why she takes care of me.
I do try.
Nature is everywhere. We can find it in the most unexpected places, and nature is health. Park Prescription, or PARX, is Canada's national nature prescription program. What the physician or nurse does is they sit down with the patient and they figure out what kind of nearby nature is in their community, and then they work with them together to come up with a plan where they can incorporate nature time into their everyday lifestyle.
Some cherry tomatoes. So this is the prescription, and it just gives my name, and it says my outdoor activity plan.
In 2022, we announced a new collaboration with Parks Canada where licensed health professionals can now prescribe national discovery passes that give you entry to national parks. There are only 2 national nature prescription programs in the world, and the first one was actually founded right in the US. Cost can be a barrier where there are day use fees, so we're hoping that by prescribing these Parks Canada discovery passes that will reduce that barrier to nature access in a significant way. Well, there are 2 major theories as to why nature is so good for our brains, and the first one is called attention restoration theory. When we spend time in busy urban environments, all the hard edges and traffic and lights and people everywhere really make us have to constantly focus our attention to kind of navigate around those obstacles. Whereas when you spend time in nature, it's really this source of soft fascination. So what that does is it restores your powers of attention and it reduces that fatigue and irritability. The second major theory is called stress reduction theory. So basically when we spend time in nature after stressful events, it helps us be more resilient and recover faster. When I recommended nature for the first time to a patient of mine, I thought he's going to look at me funny and he's going to laugh at me. But he actually just nodded his head and said, "You're absolutely right. When I spend more time in nature, I feel better." And so I think healthcare providers sort of have to get over our own mental biases against new sort of lifestyle interventions and prescribe something evidence-based like nature time more often.
50 days from seed to vegetable. I think the prescription helps in that it says this is a good thing to do, this is worth the effort to do. You need to get out of doors and just be surrounded by the greenery and by nature.
I want people to know that nature should be a non-negotiable. The thing about heading outside is that you tend to start to naturally be more active. You'll feel calmer, you'll feel less depressed, less anxious. I think it's just a great way to deal with the stresses of modern life.
Thank you to all the presenters. That was amazing. And now we have question and answer discussion time. And for those of you who are connected virtually, I did notice a couple questions that maybe had already been posed virtually. So we want to be sure that you're a part of this experience together. And just want to also invite those who presented maybe to face the audience. We could rearrange the chairs just a bit. And then Tatiana and Raquel, if you guys could come up, just to call out a few additional members of our clinicians for Planetary Health team, Raquel and Tatiana and Michael as well. And I don't know if Sandeep is here, but we have an amazing team. And just want to thank you all for inspiring us and working together with us to help accelerate this change. And my name is Nathan Utman, by the way. So we can get started with anyone from the audience. There was a slide that had, yes, a few potential ideas for discussion about things that stood out from any of the presentations, or if you'd like to share about work that you're doing, because ultimately our goal is to connect with each other, build relationship, build trust, so that we can have that transformative community. So please feel free to raise your hand. I see one there. Yep. And maybe as the mic is being obtained, Enrique had put himself in line first. So if
Thanks. Sometimes we make little mistakes, and I wanted to pass the message that in 1 minute you can discuss with your patient in the context of his disease how it relates to planetary health. And I actually I wasn't very clear on that. So I talked to the mother that she could eat less meat and so have less cattle and less burning of the forest and less pollution to the planet that was already in fire. So what I felt was that if I'm connected to her and to the family, it's easier to convey that message. So thanks. Just trying to fix a little bit.
Henrique, congratulations for the presentation. It was very interesting. I would like to know, because since it's a small town, and I have lived in several small towns in Brazil and also in the Amazon, and I see that their perspective of preserving nature is very different than the ones who live in big cities. We have tried to also do a preservation program through the citizen committee, and it was really difficult to pass that information from our perspective to their perspective. What I want to know is if you have seen some results of what you have been teaching them or showing them or trying to make them understand the need to preservation, if you have seen a result. Because what I have seen is what they think about cutting trees or even the river. Many times they didn't believe it was really possible to make it so dirty. They think nature is much more powerful because they have whatever their grandparents have lived this way. So if you could share if you have seen some difference in the change on how they treat nature.
Yeah, so I understand you're asking me if my interventions are making it better for nature. Is that it? Or your intervention made a difference in the way that the population there treat nature. Yeah. Before they treat it one way and now they So it's a very complex question, and from a quick view, maybe you won't notice many things, but one thing that I did that was very practical was just to value the way they treat cold and flu by saying, okay, how do you treat it? How does your grandmother treat it? And they say, tea, what tea? And then they started valuing it. So in that way, they preserve the species that are native. And so a lot of people come to me just to know that the grandmother has the treatment for their illness. So I start valuing that system. So I think that reinforces. But of course, I don't have the prospective research or comparison to other communities. What I know is that the Secretary of Health said that I should be the doctor prescribing plants. And I was like, I'm a family doctor and I do evidence-based medicine. And I think that that is evidence-based medicine. Another thing to know is that they use a lot of poison to plant for people at the city. But they don't use poison to plant the city for them, right? So I reinforce the fact that poison is not good. So you have to avoid it. And that helps to create, unfortunately, the dilemma and some tension. And we have seen people try to reduce poison in their, toxins, how do you, pesticides and herbicides, yeah. I'm not sure that's very great news, but it's what, yeah.
Other questions?
Thank you very much for all your presentations. I just got a question for all of you. You don't have to answer it, but I would like you to think about this. Your presentations, your research and everything sounds brilliant, but what I'm not hearing or what I'm not seeing is a whole other side to the globe. I'm just going to be a little bit biased, Africa. So it seems like the solutions, the research is very much focused on a more Western world. So it would be interesting to find out how you would apply all those things that you found in that research, and whether you would think the same solutions, the same strategies would apply in an African or Asian context. And if not, what would you do differently to make it applicable? Thank you.
So I don't want to sound pretentious, yeah, but I think I have an answer in two ways. Okay, first is I don't try to be prescriptive. I just show what I do. Okay, so I'm doing a very precise description of what I do. Although I made some mistakes in conveying it, as you saw. Okay. And I think it's effective in the way I deliver it. Of course, it's just a drop in the ocean, okay? But what I can tell you is that it's been proven that primary care providers deliver the best and the most effective care, okay? Because of those principles that I showed, right? And if you are a primary care provider, you understand how powerful the relationships are. And I really wouldn't be surprised that if you talk to primary care providers in Africa, or I've been to Mali and I've been to South Africa, and I wouldn't be surprised that if you train those primary care providers to stimulate people on how their environment is important and how they should value their ancestors, that will be important, and that will help the health of the patient and community and planet. So, yeah.
Thank you for your question, and I really appreciate it. It calls me to highlight a couple other planetary health programs. One is the hubs, and so it's really important for us to be part of the regional hubs. Sandeep, I don't know if he's here today, but seek him out, and maybe one of you is part of a hub, talk to each other about hubs, but that's where you can get some of the regional specificity. And then we are the clinicians for Planetary Health, and we invite everyone to participate and be part of this dialogue. You might say, well, why do we have so many Brazilian speakers today? Well, Brazil rocks, but they're also active members of Clinicians for Planetary Health. So the more you become part of this, the more you meet people, the more you become trusted voices, the more we can tap you to be ambassadors for this program. So I invite all of you to participate.
Hi. I think it's included in this. Well, when I said like it's one thing, like the center, lifestyle, people, life, and outside, this is a concept that comes, like especially Africa, they have this concept, I think, very clear still. And the approach that I was talking about, it is related to, I mean, more listening, to be empathic. So you're, depending on whoever is in front of you and what it brings as culture, it's going to be considered. And the prescription will be depending on what you're seeing there. And I mean, this, of course, it's like, for me, this is the rereading. I don't know if this exists in English, but you're reading again something of what you're talking about. Because in this, I mean, at least in Africa, I know that this traditional medicine and traditional culture is very strong, still nowadays. So lifestyle medicine, planetary health, is just the Western kind of, you know, getting awareness of that and trying to translate a re-interpretation of that. So it could be the way around, you know. We need to do that. It's nice that this came out. I mean, we need to, you know, develop this and spread this and then bring the hubs. And then with these people, the African rub and the Asian rub, you can improve that just, it's new, 2010 and 2000, it's like yesterday. So,
I just want to add my message. The idea is that clinicians, wherever part of the world that is practicing, we need to emphasize the work together with educators, because we need to change the concept of health. The health is considered the health of our body. In many cultures, in many parts, and many professionals are educated that think that health is the well-functioning of our systems. And then we need to put another concept and create this concept connecting the health with this environment and the planet. And then this is very important, the partnership in each part of the world.
Yeah, thanks. I think it's a really integral and important point that really brings the contextual pieces of what it means to sit with a patient, because, you know, in our communities, and I've had this discussion with Melissa, I don't know if she's still on the line, you know, I come from a community area where greater than 50% of the people are Indigenous. So if you have white physicians prescribing nature to Indigenous peoples, you can imagine, of course, the dynamic of how that goes. In addition to things like the Planetary Health diet, prescribing that to Inuit communities with over an 80% traditional meat diet, and what that means. So, you know, the contextual pieces of place are very, very important on how we consider the applications of these things, not only within geopolitical landscapes, but within the communities themselves, and what that means, not only for the relationship between, you know, the environment and people, but the relationship between the physician and the patient, and the power dynamics that exist because of the, you know, colonial concepts and all of those things that have existed for, you know, hundreds of years, depending on the country involved. And then the last piece that I want to highlight, which was the last one. And, you know, oftentimes we're learning from integrations of you know, new so-called systems like lifestyle medicine, which is not bad or good, I'm not saying that. But traditional medicine systems, specifically, in my case, traditional Indigenous medicine systems have been practiced in my region for thousands of years. And there is an innate understanding when you prescribe, so-called prescribe something, that you're prescribing it with the intent for benefit of patient and planet. So I call it patient planetary health co-benefit prescribing, the sort of Western interpretation of that, because we have medicines that when you pick them, they become more sustainable. If you pick them in a good way, they will grow better. If you don't pick them, they will not grow anymore. So we have this reciprocal relationship with that particular plant where we know we need to pick certain amounts of that plant for it to continue to sustain us in that way. So that understanding of not only utilizing the medicine for ourselves, but also for the benefit of that plant is very much a part of those. And the communities and cultures around the world that have embodied these practices of medicine, not the ones that you see being sold on the streets, but the ones truly in communities that are in relationship to those worlds, and what those traditional medicine systems have to teach us is incredibly important. And we really haven't opened our eyes too much within Western systems for how those countries and regions can really benefit the dialogue of the world as it pertains to the health of the planet. So I just want to really thank you for bringing up that question, because it's incredibly important and something I think we all need to continue to reflect on in this space.
I feel like, I don't know if you can hear me. I've been given the mic by the Zoom powers that be. I'm still here. I'm still here. Nicole, Dr. Redvers, it's so nice to hear your voice and to see you in this tiny little box here on my screen. And I want to underline everything you said. I think it's really important for us to consider the different cultural contexts, especially the context of colonization in Canada, where it comes to Indigenous peoples, when it comes to anything that we prescribe or recommend to our patients. And that's one of the reasons why we're taking our time to launch in the North. Dr. Redvers and others are looking into ways to make sure that if we launch at all in the North, that it's sensitive to the needs of the local population. And that's where I think our roles as clinicians are really important, because we are situated in our communities, we know our communities' context, and we know our patients. So I think if we keep that in mind and we don't kind of create this this sort of general kind of whitewashed or greenwashed idea of what our patients should be doing and what we should be recommending, and we remember everyone's individual context, it can make these measures more powerful. Thanks.
Okay. Yeah, so I was really gonna say the same thing about context, that context really matters. And like for me as a registered nurse and also coming from the Global South, it's thinking that a lot of the patients that we will see are already very much immersed, in nature, maybe in gardening, providing themselves with food. And so their issues are quite a bit different from the issues that we discuss here in this space today. And so it's really, I think it's almost like looking at it from the patient's perspective and discussing with them in a very honest way, like, what do you think your solutions would be? And I think for me, that's where I see the answers, because as we speak now, a lot of the village women who do a lot of interactions with the soil, interactions with nature all the time, going to fetch firewood, are also the ones who are having so many health issues because, of other factors that are there. So I think it's patient and client-based solutions coming from them. And I think we also have to think about just taking a step back and looking many steps back. I think the development we have today also pressures us. I don't know how to put it in a good way, but I think when you look at your peers on the other side of the world, you're already stressed. You're thinking about, how can I get to a conference like this one? Or how can I take my child to a school? And yet, we could also look at, how can I just learn about the biodiversity in my community and learn the ways that have sustained my people for a long time. And maybe the stress level would go down or something like that. And another conversation that I've been a part of where there are a lot of question marks is the Planetary Health diet, where we are talking about eating less meat, and especially with some Indian colleagues who are, where there's the question of, do we take away the meat that brings in the protein for the patient? And I think as much as it's very, very important for our planet, it's also really important to have this conversation and see what really is going to work for which communities and how. So I guess that's kind of a question that we could address if we have time, but it's just looking at the proteins availability for which patients that may need the meat more than other, like the rest of us.
Yeah, I just would like to thank you very much, Barbara, for bringing this up, because it opened like a very huge gap in perspective in my head, and I think for the whole group, because it's totally westernized, and have the principles to face that, because it's individual based and listening and all those things, but we have a lot of space to think about it. And I think it's practicing that we are gonna, dealing with this culture, this people, that we are gonna learn to, bridge it. And just about proteins, just very fast. I mean, I'm not sure if you were doubting about the. I didn't get it, but we can get the protein, high quality protein from plant-based. I'm not sure if you were in doubt about it or not. Just clarifying. It's just the B12 that it's. I see. It's totally inside the same discussions, like cultural and contextualizing. Where is she? Oh, she wanted to talk. Thank you.
So I do see a hand. We do have time that we're approaching the need to transition at least to the close of the formal session. But on behalf of our rich, vibrant, passionate team, we still recognize forward-facing, looking to the future with all intentionality, based in community, based in love, based in this planetary principle of what we see as emergent hope for the future. We hear you, and we are welcoming you, anyone who wants to join the Clinicians for Planetary Health space, so that at the next Planetary Health Conference, the type of gap, the representation gap or the knowledge gap is not as pronounced, so that we can incrementally work towards a state where everyone is able to speak for themselves, because we cannot speak on behalf of the areas that we are not a part of, that we are not that connected to that sacred place. So we appreciate the sentiment, and looking forward to the future, we welcome you, and we look forward to helping to make this even more passionate, transformative, and impactful the next time around. So to be continued.
I just want to close by saying we really invite you to join our community. It is a community of practice, not necessarily answers, where we can wrestle with some of these issues and engage each other and really move forward. We have this lovely little QR code that will go right to our website. Michael Z here is our wonderful newsletter coordinator, and so if you have any questions about Clinicians for Planetary Health, we'd love to have you come up afterwards, talk to us, and please, please join us as we grow this movement. Thank you all very much.